I'm Juliet, and today I'm going to be explaining what lifestyle medicine is. Now, before I begin, I just want to let you know that I have put together a diabetes lifestyle coaching program. So if you're at all interested, make sure you click on the link below and book in a telephone consultation with myself to work out whether it would be suitable and whether it would be a good fit for you. Okay, so what is lifestyle medicine? So many of you may know that I am a certified practitioner in lifestyle medicine, as well as all my other certifications and qualifications. But lifestyle medicine really is still quite new and in its infancy, so I'm sure that there'll be many of you that don't know what lifestyle medicine is. There are definitely a lot of health professionals that still don't really know what lifestyle medicine is. So lifestyle medicine is really a growing global movement that fills this void in healthcare that we have been missing for a long time, this piece of the puzzle that has just been, for some reason, swept under a rug. So if you haven't noticed or realised that there has been this explosion of chronic disease, that being obesity, type 2 diabetes, heart disease, Alzheimer's, cancer, and all largely to do with our modern lifestyles. So clearly our conventional medical system is not working. It's not actually treating or preventing this problem. So lifestyle medicine has come about because there are lots of passionate, like-minded health professionals that came together trying to find a better solution. So watch this space. Okay, so to really explain what lifestyle medicine is, I think it's important to look at the different types of medicine first. So conventional medicine is really, the type of medicine we've had around for a long time and what is sort of the mainstream at the moment. So conventional medicine is fairly reductionist. And what I mean by that is you'll go and see a cardiologist about your heart, you'll go and see a nephrologist about your kidneys, you'll go and see your ophthalmologist about your eyes. And often when there's a problem, we isolate it and think of it as, it's a problem with your liver or it's a problem with your eyes. But we know that the body is a system. So all of these things are interrelated, and when we're just looking at the one organ or the one tissue, we potentially miss a lot of other things. And with these chronic diseases in particular, there is a lot of underlying similarities in the pathology or the causes, the driving causes. So conventional medicine does tend to get a little bit too reductionist and forgets the person as a whole. Because when we're treating one thing, well, often we can sometimes miss something else, or we potentially cause a problem with something else, so with another organ or whatever it is. Conventional medicine also tends to have a heavy hand on prescriptions, medications, surgeries, procedures. So when you go and see your doctor, you might get the lose some weight or cut your carbs, watch what you're eating, but often the advice is not much more than that. And there probably are some doctors out there that know a bit more and a bit more switched on and do give better and more thorough advice, or they would refer you to maybe a dietitian or an exercise physiologist or a diabetes educator. But most of the time, I think we can all agree that medications will often get prescribed, and then these lifestyle behaviours are often not addressed again, or very rarely are they addressed. Or there'll be referrals to get procedures done, not for diabetes necessarily, but for other medical conditions. So often it's not the doctor's fault. Doctors are trained to diagnose and treat disease, and if your bloods, for example, are in the normal range, then nothing's wrong, you don't have any problems, so go off on your merry way. And they weren't trained on wellness and health in that sense, because they just weren't. So it's hard for them to know what advice to give and what exactly that looks like. So it's just a bit of another world. So conventional medicine does have a very strong evidence base. So anything in the guidelines, anything recommended, there has often been very rigorous studies that have been undergone, and the evidence has to be very strong, and you get different graded evidence, but generally conventional medicine, if something is mainstream or if something is recommended, it does have a very good evidence base behind it. Conventional medicine is quite reactive. So instead of looking further upstream and trying to prevent these things from happening, often conventional system is a lot of the money goes into the end product, so hospital admissions and medications and things that really, for these chronic kind of conditions, it gets very expensive, because then the person who is diagnosed with a chronic disease has a disease for life. So then it gets very expensive and time consuming, and obviously for the person it's a very different life, a reduced quality of life. So conventional medicine, we're often floundering to try and patch things up at the end instead of looking further upstream, investing time, resources, money, and preventing these things from occurring in the first place. Conventional medicine is also very practitioner-led. So the practitioner is often in control, which is a good thing, because the doctor or practitioner, they've been educated, they have a very solid training, and they know what they're talking about. But at the end of the day, it's you who has to make these decisions, and there's lots of decisions every day to make that will impact on your health and your longevity and ultimately your happiness. So while it's good to have a practitioner to help guide someone with a chronic disease, at the end of the day, having them being completely in control can make the patient feel powerless, and it's not very sustainable. So then, before we go to lifestyle medicine, let's look on the other end of the spectrum at this functional and integrative medicine. So really, they are quite on the polar ends to conventional medicine. So functional and integrative medicine is more of a natural way of treating or preventing disease. So it looks more at the body as a system, so it's very holistic, and the therapies or the things that they generally recommend are very natural and I guess alternative to what conventional doctors would recommend. So there's lots of supplements and natural complementary type of herbal supplements, or acupuncture, for example, although there is evidence-based, or there is evidence for acupuncture in certain conditions. So the functional and integrative medicine side is a little bit more preventative. Now, with a lot of these recommendations though, the evidence base behind them tends to be a little bit weak or limited. So it doesn't mean that there's absolutely no evidence for them, but in comparison to the amount of evidence there are for drugs, the evidence for these natural therapies is usually quite limited. And functional and integrated medicine tends to be more practitioner-led again. So the practitioner is more in control, they have all the knowledge, they will prescribe certain things, they might recommend certain herbal supplements or whatever it is, but it tends to be the practitioner in control. So lifestyle medicine then fits right in the middle. So it helps to fill this void, and while conventional medicine doctors think that functional medicine is a whole lot of hoo-ha, and while functional and integrative medicine doctors think that, or they disagree with the conventional medicine side of things, or the approach, lifestyle medicine tries to bridge those together. So we have to appreciate that there is a role for medications in some cases, and really at the end of the day, medications can be life-saving, but when we're dealing with chronic conditions that are largely brought about by our modern lifestyles and in our environment, then we need to appreciate that the medications can help, but they don't treat the root cause. So then we start to lean over into the functional integrative medicine and look at, okay, so what are these natural therapies? What are these natural type of approaches have enough evidence behind them, and what mechanistically makes sense as well? And what can we support? So lifestyle medicine sits really in the middle. So when there is a role for medications, we can see that there is a role, but at the end of the day, we want to be promoting a more natural approach that really targets and treats the root cause of these conditions. So lifestyle medicine is very holistic. There's a big focus on lifestyle, on behaviours, on our environment, and our ecosystems. Lifestyle medicine is much more proactive. So I guess if you think of a tap that's been left on and the sink is full of water and the water is spilling over onto the floor, conventional medicine is more just trying to mop up the water as much as we can, just constantly trying to mop it up, and it can be exhausting. Lifestyle medicine is more about turning the actual tap off, so going upstream and trying to prevent that from happening in the first place. So lifestyle medicine is more proactive, very strong evidence base. And when I found lifestyle medicine and I started looking further into the research, I have been amazed at the extraordinary amount of literature that supports lifestyle interventions and lifestyle changes and just lifestyle medicine in general. And at the end of the day, if you could package all of that up into a pill, it would be an absolute blockbuster. So the power of lifestyle medicine really does excite me, because there is so much that we can do. And as a pharmacist, I have moved away from the conventional side of things because I can really see the power of lifestyle medicine and how expensive and with medications, they don't treat the root cause. So it can be expensive in terms of the cost to the patient, but also because the condition or the disease will progress if we don't treat the root cause. And knowing how effective lifestyle medicine is, we can be doing so much more. That lifestyle medicine really does fit perfectly with what I'm trying to achieve and what I'm trying to bring to the world as well. The other thing with lifestyle medicine is that it really does focus on empowering the patient. So empowering you to be able to manage the condition yourself confidently and being informed. So that education part is really important, and also behaviour change. So behaviour change is a really big aspect, or a really large aspect of lifestyle medicine. So it's all well and good being informed and knowing about what things are going to benefit you in the long run, but actually being able to make and sustain those changes is what so many people struggle with. So lifestyle medicine really does address behaviour change management, to empowering the patient and helping to facilitate that behaviour change so that they feel in control and they feel empowered and really confident to get on top of their health. So if we did use an example, which I've kind of mentioned already, say someone was diagnosed with type 2 diabetes. If they went to see their conventional doctor, the doctor might say to them, lose some weight, watch what you're eating, cut the carbs. That might be about all you get, or as I said before, maybe you'll get a referral to a dietitian or something. But generally they'd be pretty ready to prescribe drugs, and then in terms of the conversation about lifestyle and weight loss and things, they tend to get forgotten or overlooked. If you went to see a functional integrative doctor and you just had a diagnosis of type 2 diabetes, then I dare say that they would probably recommend a bunch of supplements and maybe herbal medicines. And if you went to a lifestyle medicine practitioner, they would be looking at your diet, your physical activity, your exercise, your stress, your sleep, your social supports, your mental health, and so looking at you as a whole, at potentially the environmental chemicals that might be playing a role in the disease coming about. It is also there is a large group or team approach, so in that case, a lifestyle medicine doctor would be quick to refer to other allied health, so to your exercise physiologist, your dietitian, or whoever it is, diabetes educator, to get, because we understand that it's holistic and we need all these experts in these various fields to come together and work as a team so we can get the best outcomes. So the lifestyle medicine practitioner would be looking at you as a whole and trying to address all the other potential contributing factors first. If you needed medications, then that would be acceptable, that's fine, that's the way it is. But maybe we can address all of these lifestyle factors and potentially get your diabetes back into the non-diabetes state, potentially reverse it, put it into remission, and your medication use may come down or be completely eliminated or removed. So I hope that has clarified to you about what lifestyle medicine is, what it's all about, and what a lifestyle medicine practitioner is really all about. If you are interested in my program, make sure you click on the link below. And if you found this useful, make sure you subscribe to my channel so you don't miss out on upcoming videos. And if you think that your family or friends would find it helpful or useful or interesting or insightful, then make sure you share it with them as well, so we can get this movement going and people can understand and appreciate and know what lifestyle medicine is, and we can get everyone on board so we can help people to be living the best life they can and get their health back on track.